back with Dr. Davis. Dr. Davis, wrinkles, wrinkles. How do we get rid of wrinkles? There is creams, there's all kinds of, is there really actually something which gets rid of wrinkles? And I'm not talking about looking 20 when we're 50. No, I'm not saying that. But can we at least take off a bunch of years with some wrinkles? Is there treatment out there? Above and beyond all the creams, which might not work, but is there something out there which it gets resolved tomorrow?
Yes, absolutely. There's something that'll get results today. And dermal fillers are great, and I'd like to talk about dermal fillers today. I think we've already talked about injecting your own fat into your face to help do a liquid facelift, but for those that don't want to use fat or do
that own fat comes, here's the beauty. I mean, even though we're not talking about that now, it comes out of a new way of doing liposuction. So not only you inject your own fat in it, but you're taking it out from a body part where you don't want it, the love handle or the double chin or whatever it may be.
Right.
So,
right. But you can even do that, even if you don't want full liposuction. You can even take just enough out to do just the injection if that's what you want, without doing liposuction, full liposuction. So that's an option too. And it's injected the same way that we do dermal fillers. Dermal fillers are foreign substances that you inject into your body. And a lot of people think, well, I'm going to fill, say, this wrinkle here, or this wrinkle here, or this wrinkle up here, or this wrinkle up here. But what most people don't understand is that as we age, the reason we get wrinkles is because we start losing our collagen and our elasticity of our face. And as an expert in body contouring, what I've learned is, over time, you're better off not filling the wrinkle, but filling the space where you've lost the collagen underneath. So what I do is for example, instead of filling here, would lift the face this way. And I use dermal fillers all the time. But you can see, if I had wrinkles here and I lift here, the wrinkles will automatically soften. And it gives you an immediate softening. And somebody would look at you and say, you don't look tired, or your eyes look so bright. Another thing that happens as you age that causes wrinkling is hollowing up in here. You also lose bone down in through your chin area down here. And you start losing under your cheek area here. And those are areas that we treat with dermal fillers. And there are different kinds. Some kinds will link with your own hyaluronic acid in your face. Those disappear within about 9 months. There are others that have little crystals in them that will stimulate your own collagen production, and they last a lot longer. There's others that even last even longer. The good thing is, if someone makes a mistake with one of the ones with only hyaluronic acid, is it can be removed. The others cannot. Just as fat can't be removed. It would be very difficult to remove fat, so you need to go to an injector that really knows what they're doing if you want to have something that's more permanent than hyaluronic acid put in your face. That will disappear within 6 to 9 months, usually 9 months in and of itself. But dermal fillers are wonderful at making a very soft, natural look, and can take away those wrinkles and saggy-looking face, tired-looking face, and make you, it can take 10 years off of your face within 30 minutes with a good injector.
Wow. Well, let me ask you, dermal filler, Botox, it looks all the same to me. What's the difference?
Botox relaxes wrinkles. It doesn't fill them. So if I have a patient, for example, that comes to me, a big question all the time is, I've got this big wrinkle here. It goes like this. If I take it and spread it out in the ear, and the wrinkle is so I tell them, Botox is going to relax, but you're still going to have that wrinkle there. If you want that wrinkle gone, it has to be filled. you have to choose some product to fill. And after talking to the patient and looking at the patient, looking at the depth of the wrinkle, the width of the wrinkle, I will make a recommendation on what type of filler I think is best for them. And also the cost is involved. The different cost of the different products. So, and then I explained to them, they say, well, somebody said I was going to somebody else told me they were going to fill this wrinkle down from my nose down, that goes down to my mouth. And I explained to them why I don't fill it, because that's not really the problem. The problem is they're sagging from below their eye. And because they've lost all of that collagen and elasticity, and that they could be better off by actually lifting that area, and that wrinkle will automatically disappear. And then I showed them before and after pictures, and they understand what I'm talking about.
Right. Well, basically, with so many illnesses and with so many problems in life, we have such a huge tendency, and even people who should know better, to try to fix the very area where we have the problem. You know, for instance, you have a knee problem, you go and work on the knee, when your problem is really that your feet are like a duck or like whatever.
Exactly.
You know what I'm saying, right? You have a headache. You have a headache because your teeth are out of alignment and your jaws are crooked, and of course you have a headache or a back pain. You know, things like that.
Right.
But it's so easy to only look at the headache, to only look at the wrinkle as the bad thing. Well, the wrinkle is there for a reason. In fact, you're a doctor, like your kidney is bad. Well, fine, but it's not necessarily the kidney you need to fix. It's the type of stuff you seem to be putting into the kidney, which needs to change. Kind of thing. Makes a lot of sense. Makes a lot of sense. I like that. Frankly, talking to you about this, I'm the type of guy who, Dr. Davis, I haven't seen a doctor ever since I left the army, and that was 40 years ago. That was 40 years ago. That was 40 years ago. In Austria, we all have to go for a year to the army, but in any case, half a year actually. Talking to you, we want to look good. We don't want to look older than we are. We ideally even a few years younger, but at least not a bunch of years older. And tell me just with a short yes or no, the procedures you describe, they are not injecting heavy medicine and making you maybe getting Alzheimer down the road or kidney failure or any some such stuff.
No.
They're safe.
Exactly.
So I see no reason why a guy like me, as there is a couple saying, and you go, let's go and do something. I mean, we brush teeth, we wash, we go to the hairdresser, we do other things we buy expensive dyes, we do all kinds of things to look good. So why not, get your face rejuvenated a little bit. I don't think it's as bad as it may sometimes be cracked up to be, kind of like everybody makes fun of the movie stars in Hollywood. Oh, they're all doing facelifts. Well, hey, I guess as long as they don't overdo it like our dear friend Michael Jackson, I don't think there's anything.
Yes. And the wonderful thing about this is there's no cutting, there's no scars, and it's so natural looking that, as I said, most people will say, they come to me and they said, my friend said, oh, you just look so refreshed, you must have had a wonderful night's sleep last night.
Or maybe a good massage. I mean, those things have a similar effect. It's almost like maybe a little bit the lazy man's exercise. You, the doctor, exercise our body the way it should be, and put nutrition or whatever it may be in it from outside so that it does its job and kind of like generates new collagen and things like that. I kind of go, why not? After all, I wouldn't run around with a brown teeth. I would put a veneer on it, wouldn't I?
Right.
I love it. Thanks a lot. Bye, Dr.
You're welcome.